Hi, this is Dr. David Minkoff, LifeWorks Wellness Center, Clearwater, Florida. I want to talk to you about adrenal fatigue. Now, this term is thrown around all over the place, and patients come in and say they have adrenal fatigue or they have weak adrenals, and I want to kind of flesh this out and explain at least how I look at it. Your typical patient with adrenal fatigue has severe fatigue, like they have exhaustion. They may be able to stay in bed or have to stay in bed all day long. Walking from the bed to the bathroom is a chore. It's usually accompanied by mental symptoms of lack of initiative, of brain fog, of can't think straight, of can't compute a problem, like try to do a crossword puzzle or follow a movie or read a book. Very difficult. Now, your adrenal gland is, a lot of people also have low blood pressure, or when they stand up, they feel dizzy. These are all signs and symptoms. Some people with adrenal problems also get coloration, like in here and in the groin. So if their skin is normally a certain shade of color, it darkens, and this can be a sign of adrenal fatigue too. Now, so someone comes in with this symptom, and I'm looking at what caused this, or why do they have this? Now, the adrenal gland is made up of two parts. There's an inside part and an outside part. The inside part makes a hormone, or mainly makes hormones that have to do with adrenaline. These are sort of the fight or flight hormones. It's like a tiger walked in the room, what reaction would you get? Well, it would be run or fight, and that's from adrenaline. It's everything gets turned up. Your heartbeat, your muscles, everything. You're going to run away as fast as you can, or you're going to stay there and fight it out. The other part of the adrenal gland is the outside part, and it produces hormones like cortisol. Now, cortisol is a protective hormone. It reduces inflammation. And it helps people deal with stress. So when adrenal glands get tired, or when the levels of adrenaline or hydrocortisone where the adrenal gland is too tired, where they can't even be produced in enough amounts to protect the body, then the person starts to feel the symptoms of what we call adrenal fatigue. The most hallmark sign that I can ask a patient, and then I know whether they have adrenal fatigue or not, is when you wake up in the morning. Do you feel more dead than alive, or more alive than dead? In almost all of the adrenal patients, the answer is, I feel more dead than alive. Like, I wake up, I might have slept, but I don't feel like I can even move. And that's a very common symptom. Now, if they stand up and they get dizzy, if they do something for an hour and then they have to go back to bed, this can be a sign of adrenal fatigue. These are usually caused by a mixture of other things, okay? Now, it could just be pure stress. A boss, job deadlines, problems with spouse or children, or just pressure that one puts upon oneself. So this can cause the same thing as if there was a tiger in the room. The person is chronically stressed. These hormones are pouring out 24 hours a day. Some people, if they get no sleep or get restful sleep, they have these hormones coming out all day. Like many people who have sleep apnea, they don't even know it, but they're not actually getting good, deep sleep. So that their body doesn't come out of a fight or flight at night where it should come way down where everything is really turned off. That gives the adrenal glands a chance to heal and make new hormones and get ready for the next day. But if a person is having episodes where their blood oxygen is going down many times per minute when they're supposedly sleeping, they don't actually sleep. They might feel like they slept, but they don't wake up refreshed, and they're still feeling exhausted. So I'm always checking for that kind of thing. Sleep hygiene may be a problem. They've got electronics in their room, they sleep next to the phone, they keep their TV on all night. This person needs help to reorganize their life so that they can actually get good sleep. Sometimes chronic infection can do the same thing. They have chronic Epstein-Barr or cytomegalovirus or herpes type 6 or Lyme disease. And they have a chronic infection which produces inflammation, which also can cause chronic adrenal fatigue because the adrenal's on all the time trying to fight the thing. So these are the things that we generally look for. Sometimes nutritional deficiency, the person isn't getting enough vitamin C, or they're not getting enough iodine, or they don't have enough amino acids, and then their adrenal gland can't work right either, and they can't heal and recuperate. So our general approach to someone who has adrenal fatigue is, number one, what are the things that are causing it? Is it some kind of chronic infection, some kind of sleep problem? Could it be a medication that they're taking that's causing them to be in a fight or flight state? How is the status of their intestine and their digestion? These are all things that we can look at. Do they have a nutritional deficiency? To see what is underlying this. We can measure the adrenal hormones in a saliva test or in a blood test, and we can see sometimes a person's hydrocortisone level, the cortisol, the main sort of protective hormone in the body, where it should be somewhere between 8 and 20, is like 4. Like in the morning, there is no cortisol. The gland never recovered enough to be able to make it. So sometimes we have to add in adrenal hormones, DHEA or cortisol, in order to help them just from the outside provide the hormone so that they can function. And this can work very well in people, and usually they may need to do this for a number of months, maybe even a number of years, until their adrenal gland recovers, and then they can go back to their regular life. So adrenal fatigue is a real problem. There is an underlying reason. It can be treated, and people with this problem can get better, but you have to figure out what were the preceding, antecedent things that led to their body to be in that condition. And if we find that out and help them with that, they can get better. Okay? Hope this helps.